2 years ago, your hairline was here. After, it is now here. Now, these days, men and women are losing more hair compared to the past. One of the contributing factors could be the genetics. Check your father, check your brother, check your sister, check your grandparent. Ask in your family whether they lose hair as much as faster as that. Now, let me tell you, as a matter of fact, there is no any Instagram, YouTube, TikTok remedy that can fight your DNA. But what we do when you regulate your lifestyle, stress, etc., it can help to make sure that your hairline is lost at a little much less rate. So for now, see, if there is a hormone called DHT. This hormone is responsible for shrinking your hair follicles. And it is responsible for baldness or loss of the hairlines we see in most of the people. Secondly, we have lifestyle, stress. Let me give you an example. A 24-year-old Emeka went and graduated to university, but after graduation, everything was onto him, looking after the sisters, looking after the brothers, looking after the family, bills, hospital bills, electricity bills, water bills, everything was on him. And in the end, he developed baldness very faster. There is a hormone called cortisol. If it is elevated for a long period of time, it will result into loss of your hairline. Secondly, we have diet. If the diet you are having is all about noodles, cassava, posho, potato, burger, bread, every single day, sugar and carbohydrates, your stomach will be coming as your hairline is getting lost. You understand my point? So for that reason, we also have traction alopecia. Traction alopecia happens in people that plait hair, for example, women and men that plait hair, and it is stretched for a long time. It could result into loss of a hairline, and the hair continues to grow backwards until the whole head is empty. Now, for that reason, what I can say, instead of hiding and putting on capes for a long time, what if you control your lifestyle? Stress, rest enough, know how to deal with stress. Second, the diet. You have to mix vegetables, calories, nuts, etc., beans, eggs, fish. All those things will really help to slow down the rate at which your hairline is getting lost. And there are also other remedies I see people use. For example, minoxidil, which was a drug initially intended to treat blood pressure, but it had a side effect of making people grow hair, and it was used. For some other people, it works. For some other people, it doesn't work at all. There are also other things like hair transplant. Hair transplant is there. You can fly all the way to Turkey, fly all the way to America, Germany, etc. But it is expensive so long as you have money. Of course, we have side effects for surgeries. It can fail as any other transplant, and can have infection, etc., so on and so forth. But all in all, lifestyle changes is the key to all these things. The hormone responsible for hair loss and shrinking of the hair follicles is called DHT, very responsible for the loss of and shrinking of your hairlines. Now, for that reason, for now, I have to say bye-bye. Please, for those ones that have followed the platform and subscribed, you are not going to lose your hairs. You are not going to lose your hairlines. So for now, I have to say bye-bye till we meet again. Make sure you